My surgery was October 15th. Total knee replacement. Had the Mako robot. Right after surgery, everything was fine. I was walking up and walking the same day, which totally amazes me. And this is just wonderful. No pain, no nothing. I cannot wait to see Dr. Kavolus. Originally, my right knee failed me in high school, so I had surgery done to it then. It didn't come out well at all. Hurt to walk, hurt to sit, hurt to drive. I just couldn't bear to walk on it. Actually, I became a little depressed about it, that I couldn't do things, and I'd go through the day eating ibuprofen and leave all day long when I was still working, just to keep working. I found out that it was bone on bone, which was causing the pain in the nerves. Within the past few years, I've come here to Tufts, and I was hooked up with Dr. Kavolus.
He had been told by a couple other surgeons that he was maybe a little bit too high risk, which brought him to Tufts. When he got to me, he'd failed physical therapy, he'd failed oral medications, and he'd failed injections. And you could just tell from the x-rays that he was significantly debilitated. His range of motion was profoundly lacking. He couldn't even get to full extension. He was really looking for something definitive.
And they said that I was a good candidate for knee replacement. I said, well, that's what I want. Dr. Kavolus wanted to know when I wanted it done. I told him, I said, I want it done as soon as possible.
I could tell that he was kind of a go-getter, pretty ambitious guy, and very lively, so I thought we'd probably get along well in that respect. And then we booked him for a robot-assisted navigated total knee replacement.
My phone rang, and it was Dr. Kavolus himself calling me the night before my surgery to make sure that everything was all right. Did I have any questions? Was I nervous? Was I this or that? And I talked to him for probably 15 minutes on the phone. I'd already been convinced that this is where I wanted to go, that's what I wanted, but that really sealed the deal. He said that he's going to be using this robot, and it was much more accurate.
Tufts, we were the first institution to adopt the Mako robotic-assisted technology. So we got into the OR, and we didn't really have as many surprises as somebody might have had if they didn't have the advanced imaging that we do that is afforded to us by using the robot-assisted replacement tech. That allowed us to formulate a plan above and beyond what we might have done if we were using conventional instrumentation and technologies. He recovered fairly rapidly post-operatively, especially given some of his comorbidities. But all in all, he was able to get out of the hospital fairly rapidly.
2 days was I in the hospital? All right, you can go home now. Really? Great. Good morning, how are you?
Good, how are you?
Very good, thank you. I'm here for Dr. Kavolus.
What are you expecting from him today?
I'm hoping that he'll lift any restrictions that I have, and they'll be all gone, and I can go to the gym. Hopefully, I'll get the referral to go to PT. Very, very confident that things are going to go well.
Frank, how are you?
Good.
Great, you can come with me.
All righty.
Hey Frank, can I see you walk?
Yeah, sure.
You using any assistive device or anything?
Nope.
No cane?
Nope.
Fantastic.
Surgery went great. I was very happy with how that went. His knee balanced out wonderfully.
He doesn't want to see me for a year. He's given me the green light to go to the gym. Totally confident, totally happy, and worry-free. It takes a lot off my mind. And my body, too.
He's out living his life and doing everything he wants to do now that this knee is no longer prohibiting him in terms of pain and limited range of motion.
Do it. Don't be foolish. Don't put it off. You'll be glad you did. It just improves quality of life.